I was surprised that there were so many people. And I was happy that so many people come because it means that our twinning with Moldova is really world enterprise, that it means something for people with hemophilia in Moldova, that they've been waiting for something, that something should be changed. That was my first impression.
I think that the twinning program that is under development now, I think it would be also very, very helpful for the nurses, for the doctors, because our doctors and nurses don't know up-to-date things.
It has changed a lot over the last 25 years in Poland, and I hope it will also change in Moldova. But I understood at that time, when I first visited Moldova and the hospital, that it would not be so easy to introduce some modern methods of hemophilia management, of hemophilia treatment in this country.
This visit in the Balts, 2 hours away through the country, it was second shock, because the capital city, they are a little bit better with everything, yes, and then this house and this boy, and I just know that they have any care. I can remember his mother from the first visit in the Chisinau, and I remember that she'd been crying.
Of course, the problem of Marshall is that in such young boy there is a severe hemophilic arthropathy, and moreover there is a chronic synovitis.
I feel very uncomfortable that I cannot help my son right away if he has a bleed, like a bad knee. All I can do at home is apply an ice pack, then I call the ambulance and my son is hospitalized. But if the injury is severe, then I take him with my own car to Chisinau from our local hospital, about 130 kilometers, if I get permission from the local hospital. The most I'm worried about is that there is a time when I cannot treat my son on time, so that the situation gets worse. I want my son to have a bright future, to find a good job, an intellectual one, because to work physically is more difficult for him.
Yes, I do have friends, and I see them rare, because Monday to Friday they learn to school, and I can't see them, but I get out of my apartment once or twice a week.
First of all, I'm very concerned with the fact that he's not going out. He doesn't meet his friends, he doesn't go to school, so he doesn't socialize. This is a problem that hurts me very much. Of course, I worry about his relationships with girls, because he's a teenager, and all the boys of his age, I know that they go yes, on dating with girls, and he also worries about this. He doesn't tell me, but I'm sure he is worried about this.
Well, I would want to be an architect, because I would like to do the projects of the house or malls. I would want to help people with my ideas, and I hope that everything will be just like I want.
La moldoveni, când avem oaspeți, neapărat să fim cu pâine, cu sare, cum se spune simbolul.
When guests visit the house of a Moldovan, they are greeted with bread and salt, which are symbols of peace.
Așa cum suntem noi moldoveni. O nație care producem vin, suntem.
Also, wine is served because Moldovans are famous for the wine they produce, and we want to serve our guests with the best wine of the house.
In a country without access to clotting factor concentrates, this treatment modality can't be introduced. Unfortunately, the prognosis is uncertain for such patients because we know that such bleeds can recur and then occur again. And if such life-threatening bleeds occur again, then of course
in order to get to the hospital in Chisinau, I need about 2 hours, or even 1 hour 45 minutes if I hurry up and catch a minibus from the local bus station to Chisinau. There are lots of cases when I have an injury and stay at home and do not ask for any medical specialized help. In 2-3 days the hemorrhage is gone, while I stay at home, suffering a lot of pain.
Fiind singur bolnav cu hemofilie și suferind mult din cauza aceasta, eu văzând copiii aceștia...
Being myself a patient with hemophilia and suffering a lot from this disease, seeing yesterday the children at the conference, their condition and how deformed they are, already now they are becoming disabled persons. One of the aims of my activity is not to allow these children to become disabled for the rest of their lives.
I think it's possible that within a few more years, the Chisinau centers will be able to help other countries. It's very likely. They have the enthusiasm, they have the energy, they have the commitment. I think they're very happy to be working with the World Federation of Hemophilia and the twinning program.
Sometimes it is hard for a person with hemophilia to remain hopeful in Moldova. The twinning program and our colleagues in Poland, they bring us hope. Hope that we will have factor in our country. Hope that our children will lead better lives. Hope that someday we may even help others, like our twin in Poland is helping us.